recording, and 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, so a lot of you are still here. And don't forget to sign in on the side if you haven't, so that you get credits. Okay. We're gonna look at the matching quiz. But I should probably share first. Okay. So 50% of people taking this medication will develop hypertension as cyclosporin. That's that anti-rejection drug where people might retain fluid and might get high blood pressure, and that happens to a larger percentage of people. Given within a week of exposure and again in 1 month is hepatitis B immunoglobulin. So if you can give it as fast as you can after initial exposure and then repeat it, the patient might not end up with a chronic hepatitis B infection. Can lead to severe depression and suicidal ideation is that alpha interferon, which is a treatment for hepatitis B that is kind of difficult for people. Avoid ibuprofen is methotrexate. So you see methotrexate has been mentioned several times within the setting of this unit, so you can imagine that that'll obviously be on the exam. Prevents antibiotic resistance by inhibiting beta-lactamase is clavulanate. That's why it's added to amoxicillin, because the penicillins have the beta-lactam ring, but oh, I didn't write that right at all. Oh, no, I did. So, sorry, I blinked out myself there. So, penicillins have beta-lactam ring. Some bacteria have created an enzyme called beta-lactamase in order to become resistant. Clavulanate inhibits beta-lactamase so that the amoxicillin will still work. Could increase bleeding time is that cefotetan, which is one of the cephalosporins that can be given for meningitis. If this medication is given too fast, could cause red person syndrome, which is where the person gets flushed and red throughout their entire body. It can have low blood pressure. Could cause Achilles tendon ruptures, ciprofloxacin. Could lead to respiratory symptoms and bronchospasm as Zactam. And taken to measure the lowest level of the medication, the bloodstream is a trough. So just a little review there. And then we will go through the last group of slides, which should be pretty quick because it's the growth factors. So obviously cancer is one reason why you would put somebody on a growth factor, but you could also do it in cases of chronic illnesses. The growth factor that we use during cancer is the one that supports white blood cells. Because the person will experience those nadirs that we talked about. This is kind of hard to see. This is a picture of all the cells that are made in the bone marrow, which we've talked about, white blood cells, red blood cells, and platelets. If the person's red blood cells are too low, they have anemia, what kind of symptoms do people have when they have anemia? Fatigue, cold, pale, right? Good. Weak. So our red blood cells give us oxygen. Good. If we don't have oxygen, we will feel tired, cold, pale, potentially weight loss because it does tend to decrease people's appetite. And you will have compensation of an increased heart rate, increased respiratory rate because your body's trying to get more oxygen. What if the person has low platelets? What kinds of symptoms would they have? Right, bruising, easy bleeding and bruising is the main thing. Petechiae, so you could see that they have just minimal trauma could lead to some kind of bruise. What if the person had a low white blood cell count, which we've talked about a bunch of times, is really just infection risk. Right. So in this setting, you can give a growth factor to increase red blood cell production. But that's not given during cancer because the growth factor that increases red blood cell production can actually increase cancer. So during cancer, we just give transfusions and maybe iron or other things that will support um, red blood cell production, but we don't usually give epogen because that increases cancer growth. Um, and generally speaking, people don't take the growth factor for platelets during cancer treatment. They're given transfusions if needed. Um, the people that are given the medication that helps support the growth of platelets are people that chronically have low platelets. There are different viral illnesses and different illnesses that lead to people always having low platelets. And so to decrease the need for transfusions, they take a medication to help increase the amount of circulating platelets. During cancer, people often take filgrastim, which is Neupogen, because that increases white blood cell count, and we try to time it around the nadir so that when they're supposed to reach their lowest point, they actually have in a better white blood cell count. So the question is, do Jehovah Witnesses use growth factors to avoid transfusions? Only some of them do, because they're technically made with blood proteins, and so it depends on how strict they are, whether or not Jehovah's Witnesses will accept epogen. Um, it depends on their church leader, if that's okay. And the way because sometimes people, I mean, I've taken care of through the course of my long time as a nurse, which is a long time, taking care of people that have avoided transfusions because they're Jehovah's Witnesses and have had extremely low hemoglobins, like 4 or something. But you have to remember that their belief is that if they receive blood that's been outside of a person, then they will be doomed to eternal damnation. I mean, there's no way you're going to convince somebody that's a Jehovah's Witness that they should get a blood transfusion if they think they'll be damned to hell. So if you kind of remember that, you might not, you might be a little more sensitive about it. I mean, there's nothing that you can do. But some Jehovah's Witnesses will use growth factors. So our 3 growth factors are epogen, filgrastim, and L-trombopag. And epogen is sometimes referred to as epoetin or EPO, increases red blood cell growth. Filgrastim is Neupogen, which increases white blood cell growth. And L-trombopag is Promacta, which increases platelets. So epogen is given for chronic anemia or kidney failure. That's its use. And it stimulates production of red blood cells. You do not want to give it to a cancer patient because it'll feed the cancer. This is actually a drug that's abused by athletes. That's what people mean when they say blood doping, because they're trying to increase their oxygen carrying capacity. And that is why some people think that Lance Armstrong's cancer came back, because he actually did use EPO at the time that he won all of his Tour de France's, and then that's like the theory anyways. But so this is a subcutaneous injection that's very expensive. You don't want to shake it. The issue is, the biggest issue, here's your main side effect, a potential elevation in blood pressure. Here's your main adverse effect. If you increase the amount of red blood cells that are present in the bloodstream, you have a risk of clots. So that's what you have to worry about. So someone who is on epogen growth factor will have their red blood cell levels checked to be sure it's responding. They'll have their blood pressure checked, and then we would be mindful of any symptoms that suggested clots, like you guys went through before. Which medication did we talk about that could potentially cause clots? We talked about it today. You're probably like, oh my God, Schultz, I have no idea. can repeat the question. So I just was talking about how epogen increases red blood cells, and an increase in red blood cells in the bloodstream, especially if there's too many red blood cells, can lead to clots or thrombosis. And I said we don't have to go all over the symptoms of thrombosis or clots because we did that this morning when we were talking about a different medication. Do you remember the medicine? The other medication we talked about this morning, it's an immune stimulant that could potentially cause clots. Wow, me, Lillian, I see it. No, that's honest. I'm giving Lillian a chance. She's typing. And the right to remain silent. You do not have that right now. It was immunoglobulin because it had the similar effects of vaccines, in which you would have that like viral syndrome kind of feeling, headache, muscle ache, low-grade fever. But the immunoglobulin had risks to kidneys and risks of clotting because it was a little bit different. But you knew that, you just forgot to say. Okay. Here's the one that we would use in chemotherapy, and this is when we want to increase the number of first-line white blood cells, and we don't want to give it at the time the person gets the chemotherapy, because by the time they get to the nadir, it won't be there anymore. We want to give it so that it peaks during the patient's nadir, like we talked about before. For this, the biggest, most common side effect is right here, is bone pain, because it works really well and it's going to cause the femur and the hips to increase production of white blood cells in their bone marrow. And so the person will feel like a really internal stretching bone pain that often does require narcotics. It's that painful. So people should be aware of that. And if the white blood cell gets too high, the biggest adverse effect is right here for you. It's splenic rupture, because extra white blood cells will be sequestered in the spleen. So there are white blood cells that are ready to divide in the spleen. The spleen is a secondary lymph organ like the bone marrow. So if we kind of overproduce those white blood cells, we could stretch the spleen to such an extent that it bursts, and spleen is very vascular and the person could bleed. And then the last drug increases the number of platelets, and this is given for chronic disorders in order to decrease the need for transfusions. This is not given during chemotherapy, only filgrastim is. This common side effect is sort of like those flu-like symptoms, arthralgias, myalgias. So that's our common side effect. Our biggest risk when we increase the amount of platelets in our body is another clot, because we've increased the amount of circulating clotting things. All right, so the medications, I did update the study guide because I didn't see the growth factors on there, so be sure you look at the new study guide when you're studying for the exam. That's next class. I think that's it, unless anyone had any other questions. The new discussion board is going to open. Please take the time to do those things to get the extra points. It makes me sad when I see that people don't do them, because then the semester ends and they're like, how can I get extra points? And I'm like, why didn't you do it when I said? Because I can't give extra points. When is it due? The first post, let me look at my calendar here. Today's the 30th. Oh my god, it's gonna be July. The first post is due July 3rd. The second is due July 6th. And remember, your second post cannot be, "You are so smart." It doesn't count. It has to be a critique that will help your classmate improve their education of patients about medications. Seeing what people are typing. I mean, if y'all would like to tell me, yes, you can. I mean, it's not like you cannot tell people they're smart, but then you have to actually tell them something that they could improve on. You could do both. It's always good to give people their improvement in a compliment sandwich. You say something good, and then you say what they can improve, and then you say something good again. You can do that. Otherwise, yeah, I do check my email every day. So if you have any questions about stuff coming up, and again, the ATI that's due, yes, it is every medicine. That's a good question. The ATI that is due is the immune one. So if you didn't do the hematology one, that's okay. But in order to take the exam, you must complete the immune medication ATI, upload it with a score of 85% or greater. The check-in opens at 8:55. You can just go right to Blackboard and check in and begin the exam. Don't waste any time because the exam will automatically shut off at 10:45, no matter what the clock on the computer says. All right, guys. I will process these recordings and post those as well. Is there a way you can change the time on the exam? Oh, like while you're taking it to tell you that the time is running out? There isn't. Is that what you mean, Sharita? No, I can't. Because it'll only let me put in the time that I would allow max. But of course, um, if you say you checked in late, then if you actually checked in and didn't start the exam till 9:30, I can only do it for everybody. So if I change the time for one exam, I end up changing it for all. So I don't know if you keep like put in a alarm on your phone so you know like, oh, 30 minutes left or something to help you instead of relying on the computer. That might be helpful. Like put extra alarms like hour left, 30 minutes left, because you can get swept in and think like, oh, I have plenty of time, and then you're messed up. Yes, like last time. All right. Have a good week, guys. Enjoy the 4th of July. Although I don't think there's gonna be any. I don't think there's any fireworks, but there's just the random fireworks everywhere. But you're welcome. You guys have a good week.